right.
Okay, perfect. Okay, everybody. Well, welcome to the Healthy Joints, Healthy Life show. And we have a treat for you today. My name is Dr. Arinola Dada, for those who don't know me. And I help people with joint pain and autoimmune diseases become pain-free and get their immune system back on track. So today is exciting because we have the amazing, phenomenal Dr. Dipa Gali. And I will tell you right now, she is double-boarded in internal medicine and rheumatology. And she is really one of the most compassionate doctors that I know. The best information I have now is that Dr. Gali is going to be joining our practice at Overlake Arthritis in the greater Seattle area. So Dr. Gali, when you listen to this, then you'll know why I'm so excited, okay? So Dr. Gali, please introduce yourself and tell us what makes you passionate about what you do.
Hello, everybody, and thank you, Dr. Dada, for the great introduction. It has been a pleasure to have known you, met you. You're a true inspiration in our society, and I'm so excited and looking forward to joining the amazing Overlake Osteoporosis and Arthritis Clinic very soon. Looking forward to working with you, the amazing rheumatologist, Dr. Dada.
Thank you, too kind.
Okay, here you go. So coming to the introduction, my name is Dipa Gali. I'm one of the rheumatologists practicing in the beautiful Pacific Northwest for the past 7 years. And then I moved to Greater Seattle area in 2020, and I love it here. I'm going to stay here for long term, I guess. Coming to my education, I completed my internal medicine and pediatric residency at Louisiana State University, followed by my rheumatology fellowship at Wayne State University, Michigan. So I'm really excited to have met many mentors and rheumatologists at my fellowship. I feel like I have enough experience and I've been taught a lot about rheumatology. I feel comfortable practicing. So the passionate about being a rheumatologist. The most important thing is I find taking care of patients with inflammatory arthritis and autoimmune diseases very fulfilling. My passion lies with taking care of patients with rheumatoid arthritis, psoriatic arthritis, gout, and ankylosing spondylitis. And what I enjoy the most is the relationships that I develop with my patients who especially need long-term care. Over the years, I not only help them with their medical conditions, but get to know them at their personal level, get to talk to them about their family, kids, and grandkids. And there have been times when we have hugged, cried, and laughed together. It is just amazing.
No, yeah, that is so. That I totally agree with that sentiment, right? I think that's one of the things that most rheumatologists would say. And I would say Dr. Gali is very modest. She is phenomenal, right? But I think that just that, the relationship that we have with our patients with autoimmune or rheumatologic conditions actually is probably one of the most gratifying part of it. Is that you see them from when they come in and they're having a hard time, and then you see what kind of, when you're on that shared journey towards their wellness, and we see it on the other side, it's really just so gratifying and really makes it, I think that's what makes rheumatology really special. But yeah, and I think that's where we really connect. And so that's so true about how we feel about rheumatology.
I agree totally.
Yeah. So why did you choose rheumatology?
Well, go ahead. Well, rheumatology is very fascinating. The field by itself is unique. Each person is unique. It's a complex cases, and have the privilege of being able to diagnose and treat is very fulfilling. No one rheumatoid arthritis case is same as the other. It's always challenging to treat. Compared to other subspecialties, rheumatologists are more like detectives, trying to get clues and trying to find a diagnosis and treating them. We are more like investigators with a solution. So it always keeps us on our toes trying to find the diagnosis and getting to the right treatment. I think that's why I chose rheumatology, because it's always fascinating and it's never boring.
Never ever boring, Dr. Gali, never boring.
Yes.
So can you tell us like a story, right? I think a story would be nice. About kind of an amazing outcome, what kind of, like an outcome you'd like to share with our audience.
I think there are many cases, but Dr. Dada, like one case or one person that strike me the most is on a regular clinic day, during my normal clinic hours, I saw a young mom, age of 33 years old, who was wheeled in by her husband because she was so disabled from severe joint pain. And I could see in their eyes that they were so desperate for a diagnosis and a solution, because they've been going to different clinics and the ERs for the past few months. They've been getting treated with steroids, where she was having just a minimal relief, but was having a rebound effect after the treatment. And then as I started examining her, I just saw that her joints were so swollen in her fingers. Most of her fingers were looking red and they looked like sausages. And she was covered with rash. After completing my examination, it concluded that the diagnosis was of more of severe psoriasis and psoriatic arthritis.
Okay.
So we discussed the treatment, and then we started treating her. And of course, I had to battle with the insurance to get the medication, proper medication, to get it approved and start immediately. I had to be aggressive with her severe case. And guess what? After 2 months, she walks into the clinic all by herself and brings in her daughter. And to see that her walking just filled me with tears. And this is the moment I could say, I love what I do. And I look for many such successful stories to come.
Yeah, that is just such a moving story. And I think that's what kind of helps us get up in the morning and just kind of keeps us going. I love that story. And that was just an excellent find too. Not just looking at just the fact that she had swollen joints, but also associating it with the fact that she had psoriasis, and then coming to that kind of conclusion that they were both related and both related to her immune system. And we don't even want to go into insurance companies. We're just going to put those on the side. But yeah, also it's like, a 2-for-1, right? You were able to make the correct diagnosis, deal with the insurance company, which is always a pleasure, and then get her on the medications that she needed and get her the results and the quality of life that she wanted. And I love the fact that she brought her baby in.
I know, being a mom of 2 toddlers and me being a mom of a toddler, I could totally relate to her sadness. And it was so good to see her play with a toddler that day in the clinic.
Oh, that's wonderful. That is wonderful. So, I have some fun questions.
Oh.
So, what superpower do you wish you had and why?
Wish I had. No, I do have a superpower. Being a rheumatologist is my superpower.
That is the best answer ever.
I mean, I think we are a subspecialties where nobody knows what's going on, and we walk into the field, come up with a diagnosis, and treat, and they're up and walking after the treatment. So I think that's the greatest superpower we have, because we're able to help our patients who are struggling from joint pain getting back their life.
I love it. That is such a good answer. Okay. I love that answer. That's fantastic. So, at Healthy Joints, Healthy Life, we love to give our viewers wins, right? So, can you tell me or give me, as well as the viewers, because I'm going to take notes on this, what are 3 easy tips that we can implement to just become healthier versions of ourselves, right?
Yeah. Well, this is the best part of what I do in the clinic. This is at the end of the conversation we have with our patients. So they love it because it's more on the preventive care rather than the medicines that we give. So always remember, it doesn't matter what we have done so far, but the most important thing is what we will do that will change our life. What's the best next move we can do? We always have a next step to do. So number one, eat balanced diet and stay well hydrated. That meaning do home cooked food or fast food, drink more water or carbonated drinks. And then we have seen that anti-inflammatory diet like Mediterranean diet and avoiding processed food helps overall health. And coming to my next point, this is my favorite. Replace binge watching with exercise. I know it's hard to do, but just start where you are and do not get overwhelmed. Not the least, sleep. It's very important for our immune system. It is at least good to get 6 to 8 hours of sleep and a good quality of sleep. That will overall improve our pain and quality of life. This I've personally read, and I've watched sleep specialists who talk about how it's going to help with our autoimmune diseases. So I think sleep is very important.
Yeah. Well, thank you, Dr. Gali. I actually made some notes just to kind of reinforce kind of what I know, because you can never hear it enough. You know, we're always looking for shortcuts, but I think that is so helpful. And just to recap for our audience, one, we'll start from the bottom up, 6 to 8 hours of sleep. I struggle with it myself on weekdays. Weekends I try to make up is probably bad, but you know, I think trying to get into bed early and try not to binge Netflix. Try not to binge on those shows on TV. Rather getting up and working, you said, and then trying to do more cooking and trying to avoid processed foods. And I totally agree that that definitely helps the immune system. And so great. Well, Dr. Gali, this was just so good. I think we really just wanted this as an opportunity for people to get to know you and just kind of share in just the amazing person and physician that you are. And I think it really came through how, the fact that you're just a caring rheumatologist that really just loves, enjoys her patients and what she does. So we should definitely do this again sometime, and maybe we'll talk about different autoimmune conditions then. But for now, to our guests, if you think this video has been helpful, please like it, please share it. If anyone you know is in the greater Seattle area, Dr. Gali is joining our team at Overlake Arthritis, and we're excited to help you on your journey to a healthier you. Look us up at overlakearthritis.com. Thank you so much for watching. Take care, everybody.
Thank you, Dr. Dada.